In this sequence, we're going to demonstrate lymphatic drainage techniques for the head, neck, and ears, nose, and throat region. There are certain relative or absolute contraindications to this technique, specifically if you have an acute indurated lymph node or potential malignancies of this area where you would not treat directly over those areas. We typically do a treatment sequence starting from central and working peripherally, but first you would treat any facilitated segments of the cervicothoracic junction and first rib, and then free up the thoracic inlet and outlet by doing either a fascial release technique, either in a direct or indirect fashion, finding either the E's or the binds in all three planes, either flexion and extension, side bending and rotation. And then if you did an indirect technique, you'd stack or add up all the E's and then wait for the fascial creep. Or if you were going to do a direct fascial release technique, you would stack all the binds into the barriers in all three planes and again, wait for the fascial release. So after treating the facilitated segments and freeing up the thoracic inlet and outlet, you may affect the left side because of the left thoracic duct in trying to free up the first rib at the first rib region, and then begin the treatment sequence beginning with the anterior cervical arches. And we're going to have ask the patient to lift their head and control the head with your hand with a little bit of an elevation. And we're going to come across and we're going to use our hand in a horseshoe-like position, and we're going to palpate the lateral edge of the hyoid bone with our index finger and our thumb, and we're going to gently do a lateral movement with our fingers in such a manner where we contact the hyoid and we just move back and forth along the hyoid, and then we'll move just inferior to the hyoid to the thyroid cartilage, and then continue moving inferiorly to the cricoid, and then the laryngeal cartilages, and then the tracheal rings. And then we can work our way right back up from the trachea to the larynx, to the cricoid, to the thyroid, and back up to the hyoid. And we can just repeat this 30 seconds to 2 minutes. After we finish treating the anterior cervical arches, we can move to the head of the table, where we would treat by doing a submandibular release. Gently using the pads of our fingers to engage the tissues from caudad to cephalad, engage the tissues, and then just decide whether we're going to do either direct into the fascial barrier or indirect to the E's, and treat it as an indirect or direct fascial release technique. And we could wait for our release or our fascial creep, as is typical when we do our fascial release techniques. So after we do the anterior cervical arches and the submandibular release, we can decide to treat either the left or right side, and we have the patient rotate their head toward me and lift their head a little bit. Be careful not to make a vacuum lock on the patient's ear. May have to elevate the head slightly so we can help promote the drainage. And now we're going to treat the anterior, posterior cervical chains, initially starting along the sternocleidomastoid with the pads of our fingers. And initially from the lower third, we will start on the sternocleidomastoid. Just try to patient let their head relax in there. She goes, okay. And then with our pads of our finger, we're going to do this milking motion, starting with our index finger and then our long and then our ring, and milk right down along the course of the sternocleidomastoid down to the sternal attachment, and then go about halfway up and milk right along the muscle all the way down, and then at the mastoid origin, and then work down the whole course of the muscle to promote that drainage along the sternocleidomastoid. Now we'll decide to go posteriorly to the sternocleidomastoid, and the same thing, engaging those tissues with the index, long, and ring finger, and then milk down, and then go a little bit higher to promote that drainage, and then go post-occipital along that posterior cervical chain. And now we move anterior, and we start in the lower third, and then go to the middle third, and then we go just underneath the occiput, or the mastoid, excuse me, and work our way right down. So we have our long sternocleidomastoid, and then the posterior chain and the anterior chain. And right in this position, we can go to the mandibular drainage technique, which is typically known as Galbraith technique. We're going to ask the patient to very gently open their mouth, making sure the patient doesn't have any significant temporomandibular joint dysfunctions. We're going to use our fifth finger and our ring finger to control and contact along the rim of the mandible, contact, and then put the rest of our hand gently over the mandible. The patient's mouth is slightly open, and then we're going to just make a little gentle contact. This is not a hard hook, but a gentle contact with primarily the fifth finger, ring finger, and the hypothenar eminence along the mandible, and the patient's going to relax, and we're going to gently draw the mandible toward me to open up the eustachian tube and then release. So it's almost like a quick pull and then release. And it's down and toward me. Down, toward me, and release, okay? That's your Galbraith technique. Now we can do a periauricular drainage, so we're going to just open our fingers up and slide our fingers in between the patient's ears. So the patient's ear is between our long finger and our ring finger, and the rest of the hand makes as much fascial contact with the rest of the face, and we're going to gently try to move as much soft tissue as we can, either in a counterclockwise motion or a clockwise motion, or we can just rock back and forth to get a lot of fascial stretch involved. So counterclockwise, clockwise, or just the stretch. So after we did the initial two in the midline, we do the three on the right side when we did our chain, anterior chain, our Galbraith, and our periauricular. Then I turn around and do the opposite side. So now I turn and go do the left side. And then after doing that, I come up to the frontal bone, and where the frontal bone articulates with the nasion at the frontonasal suture. And there's several modifications for this technique. Some physicians like to use their index finger, and they'll cross right along the line of that suture line and controlling the head, and we'll make a contact with air, and we just distract along the angle. So I am actually pulling with good contact on the frontal bone. So you're actually distracting the frontal bone from the nasion at the suture. And then you can do the same thing from the other side. Or you can crisscross your fingers and then just alternate the pressure using one finger and then the other finger. Some physicians would use the thumb and distract and distract. And then there's another modification where we can contact the frontal bone with the cephalad hand, the nasion with the caudate hand, and do a little balancing where we do some distraction, and we could actually distract and then balance that suture from the frontal and the nasion. Alternating nasal pressure. And now we do trigeminal stimulation, remembering that the cranial nerve 5, the trigeminal nerve, has 3 branches, and the ophthalmic branch exits through the supraorbital foramen. So we can find the little foramen just along the supraorbital ridge. You'll feel a little opening there, and we can either use our long finger or our ring finger. We could use just one finger and make gentle clockwise and counterclockwise circles, or you could use your long finger and then put the other 3 fingers right on either side of it so you get more contact. And again, you could just do clockwise or counterclockwise circles over the supraorbital foramen where the ophthalmic division of the trigeminal nerves. Drawing a straight line straight down, if we come straight down from that supraorbital foramen, you'll find the infraorbital foramen where the maxillary division of the trigeminal nerve exits. And again, We can just use one finger, or we can place one finger on and the other fingers on either side to get more contact, to add clockwise or counterclockwise circles on the infraorbital foramen or the maxillary division of the trigeminal. And again, following that line from the supraorbital to the infraorbital, we'll find the mental foramen, where the mandibular division of the trigeminal nerve exits. And again, clockwise or counterclockwise circular motion to help promote trigeminal stimulation and lymphatic drainage. And after finishing with trigeminal stim, we can do a gentle effleurage technique, starting up at the frontal bone and just doing some gentle myofascial effleurage from the temporal bone. Now from the frontal to the temporal, and go right from frontal to temporal to the maxillary for a nice, relaxing effleurage technique. And then we could end the technique with a nice suboccipital decompression and relaxing, and let that suboccipital region just balance right on the pads of the fingers and just relax. So this is a treatment sequence for lymphatic congestion of the head, neck, and upper extremity, but also each individual technique can be used individually for specific conditions like laryngitis, pharyngitis, sinusitis. Nice application for this technique, especially in the pediatric population, is where you do this on the young child and then demonstrate and have the mother treat their child several times a day to help promote this lymphatic drainage. So that's your lymphatic drainage techniques for the head, neck, and ear, nose, and throat regions.